making coffee, is signing an executive order. Executive order number 1, which requires the Department of Health and Human Services and all persons working there to help implement a Medicaid expansion immediately. It requires that the deadlines be kept, if not moved up, for regulations, implementing, enacting regulations according to the law that was passed over a year ago. And it requires that the Department of Health and Human Services take every step to make sure that the state plan amendments that are required be fully implemented, be fully consistent with the requirements of CMS, the federal government. Along those lines, excuse me, I also have written a letter to Secretary Azar, is that how you pronounce it? Azar, thank you. She knows Washington. I've written a letter to Secretary Azar concerning the state plan amendment and emphasizing that the state plan amendment should be approved as soon as possible with a retroactive date to July 2nd of last year, and that state plan amendment is in accordance with the law enacted by the people in November 2017, and that we wish it to have expedited approval. So those are 2 of the things we've done today.
So what does this mean for the folks in the 70 to 80,000 group? This is nothing immediate. What does it mean for them?
It means that the Department of Health and Human Services will take every step necessary immediately to open eligibility, to find to create a portal on the website, for instance, to reach out to hospitals and providers so that when people present with issues and they clearly may be eligible for Medicaid under the expansion, that the hospitals and providers will notify the department and help expedite those eligibility approvals. It also means that the department will take every step to contract for eligibility specialists to move up the process.
How many people do you feel like this, how many people will it actually help, do you feel like, and why do you feel like it's important to do this?
I think it will help thousands of people in the next few months especially be able to attain the benefits that they are due.
Be likely to still be a few months perhaps before federal money starts flowing? Do you know?
That's an open question. There are certain deadlines that the CMS, federal government, has. We're asking them to expedite. This thing has been pending too long. You know, I mean, the state plan amendment filed in September, that already was partially incomplete, and it was not pursued energetically, as you know, by the previous administration. Now we are saying, we're sending every signal we can to everybody we can that we will energetically pursue state plan amendment and implement the law and the will of the people as expressed in the election of November 2017.
Are the applications that you're directing DHHS to pursue retrospective to the effective date or prospective from the adoption
I'm not
date?
sure what you mean.
Well, people who wanted to be, or who were eligible, or tried to apply back in the summer.
I think there are several groups, Steve. There's a smallish group that applied or tried to apply as of July 2nd, between July 2nd and October 1st. We're looking at that group separately. Some of them took appeals of the denials. Apparently there was a pro forma denial of those applications. So we'll have to look at them separately and see where they fall. And then look at groups that have applied since then, and now prospectively from this time on.
And I would just add that the Affordable Care Act created the Medicaid expansion as a state option, not something that the federal government can say yes or no to. So like the 35 other states that have filed the paperwork, we do expect approval.
Is there anything that you would anticipate that would get in the way of that? Either the state plan amendment that was filed by the previous administration?
No, we think other paperwork was filed today with the feds answering the federal government's questions that they posed back in November that were not yet answered. We have answered all those questions, so every step has been taken to fulfill the requirements of the federal government and federal law to make sure that the state plan amendment is approved. There's no reason, in my view, why it shouldn't be approved, and approved retroactively to July 2nd.
I know it.
Was one of those questions you didn't answer about how Maine is going to fund its portion
No.
of all this? And do you have any thought about that? How
Of
they-
course we thought about
Well,
it.
yeah.
Gee, that's enough. You mean sustainable funding? What a novel concept.
Do you have a plan yet in place?
Yeah, we have a separate group of people working on the budget, including the budget aspects of Medicaid expansion. And right now, you know, the money is there. The money is there for Medicaid expansion. You remember, as Attorney General, I negotiated a $35 million settlement with two major tobacco companies, the largest tobacco companies in the world. $35 million. That's sitting there right now. And we, you know, we understand that there was a $37 million so-called surplus in the Medicaid account as of last July, as reported in the newspapers. There is also, you know, general monies available, so we want to be able to budget accordingly.
Well, these are finite. I mean, are you committing to have a sustainable plan, ongoing
Of
plan
course.
by the end of the budget cycle?
Of course.
What will that be made up of?
It will be in the budget, the biennial, oh jeepers, bicentennial. It will be in the biennial budget as we propose it to the Maine legislature within the next month and a half or month. Yep.
So it'll be in your initial budget proposal
Yes, it
coming out
will.
later this month. You'll have a plan.
And Commissioner, I guess I would ask you this question. So for the people, however many thousands who applied and were rejected or their applications are in limbo, they said, well, how soon would it take for me to be able to go to the doctor or wherever and have the visit covered? How do you answer that?
So we have all those people's information, and we will be in the coming weeks reaching back out to them to explain what the process is. So again, as the governor said, there's that group who applied early, consistent with the law, but inconsistent with the previous administration, everybody going forward. And our systems will be ready beginning as soon as next week to help process people newly coming in.
Do we know how many people roughly have kind of been denied so far? The last administration said there were like 3,000-ish. But that was
Yeah, we're still working on those
Yeah.
numbers.
That's probably in the ballpark.
Commissioner, have you hired more people, and what sort of staff are we looking at to ramp up for Medicare expansion, or do you have enough people right now?
Sure. So in terms of the people needed to expand, while there's certainly a need for in-person assistance, we've seen other states that try to tap into people in hospitals or community health centers. And in fact, one idea that we have that the governor can talk about is how do we engage the partners in the healthcare system?
And we'll be meeting with them hopefully next week or so,
Yes.
maybe as early as next week, to talk to the hospital people and the providers associations, the Maine Medical Association, Maine Primary Care people, to see how they can expedite people becoming eligible for Maine Care benefits under the expanded program. When they walk into the office and they don't know that they might be eligible, these are important tentacles for all of us. Networking is important.
yeah, something we definitely heard a lot last year was that there was going to need to be like 100 new staffers to help. There's going to be like
Yeah, you know, that was the previous department, previous administration's estimates to the Appropriations Committee. Some of the other estimates they gave the Appropriations Committee were also rejected, not found to be appropriate or credible. But we'll see as we go along. I mean, you have to get the motor started. You got to jump start this engine before you can get it down the road. And I'm eager to get it down the road because this is so critical. People are dying right now. People are going without preventative care. People are going without primary care. People who may have diagnoses that could have been earlier detected and diseases earlier detected and life-saving medications provided to them because they don't know that they might be eligible.
Who's even running things over there right now? I mean, you're not the commissioner yet. So what's actually going on in?
She's actually in the department.
So I have been working with the team that's there very well and very aggressively because I do think that there are people who work at the department whose goal it is to come to work every day and try to today's filings to finish the paperwork, to secure the approvals, but also to begin the operational changes so that we're ready to, over time, and we'll ramp up, to really ensure that everybody who's eligible knows about their options and gets covered.
So you're working with the staff, just so I understand what you're doing over there today. You're working with the
Yes.
staff just kind of informally alongside them, or how is that?
And acting commissioner, previous acting commissioner Beth Ham
Yes.
has been helpful as well, working
Extremely.
alongside.
Mm-hmm.
Okay.
Governor, can I ask you an unrelated question?
I don't know.
Based on comments, it depends on what it is. I'll ask.
Ambush, Mr.
Two
Ambush.
things. You talked last night about appointing somebody to take charge of opioids.
Yes.
I won't use the word czar, but I guess I
No,
just
no,
did.
no. Director.
Why is a special person necessary?
Well, look, I've always said, if I'd been governor a few years ago, if you were governor a few years ago, you'd have seen this epidemic coming. I mean, it's hitting us like a 10-ton truck. And you would have appointed somebody to be in charge of this, to report to you every single day about what can be done and what we are doing to defeat this epidemic and stop it in its tracks. And that's what I'm talking about doing. And we already have a lot of work being done, quite frankly. Since the election, I've had somebody out there scouting the territories and finding out what's working, what's not working, perhaps as well as it should. What we can do by executive order, by financial order, by legislation, et cetera, to make sure that anyone who needs help gets help. Anyone who needs treatment gets the treatment that is appropriate for them. And that when you call 211, for instance, and you have substance use disorder, you don't get referred to somebody else 3 months down the road. You get a contact immediately, like Mid-Coast Hospital does, for instance. And that if Narcan is not readily available in the communities where it should be available, we'll make sure it is available. We're looking at the hub and spokes treatment model in Vermont, and some folks have said we sort of have hub and spokes treatment model here. I'm not so sure that that's accurate. I want to do a better job of fleshing that out, making sure we have as many intensive outpatient programs as we could. That's very successful. Peer counseling, recovery coaches at every emergency room on call and every clinic. When Narcan is out there, as it is now, we're saving lives. People are presenting to the emergency rooms, sometimes in life-threatening situations. They're being administered Narcan, but there's that gap then that we've seen in most places. The gap where the physician or physician's assistant at the emergency room should be able to call an 800 number or call a local person who can bring in a recovery coach and who will have somebody available at the emergency room who is certified to do medication-assisted treatment. That requires certain federal number of hours of training to provide Suboxone, Vivitrol, those kinds of things. So we want those things to happen, and we want to be talking to the hospital association, the medical association, about how we can do that as quickly as possible. And then you get somebody's, you got to turn their lives around and not just become a revolving door. Narcan does and should save lives, but there's more to saving the life than just medically bringing the heartbeat back and the respiration back. It means saving the person's life, giving them a new purpose in life, a new soul.
We got time for one more, guys.
Is there any decision made on the waiver yet? The work requirement waiver?
No, we haven't really discussed it in depth. I know it's out there. I started reading it the other night, I fell asleep. It's like 37 pages long. We're checking on the status of it, talking about it, but not in depth yet.
No commitment on it? Yeah.
No commitment either way, any way.